Each year, more than 13,000 women in the U.S. will be diagnosed with cervical cancer, and more than 4,000 women will die. Because it develops over time, it really is one of the most preventable types of cancer. And joining us now as part of Cervical Cancer Awareness Month is Dr. Jacob Estes, Section Head of Gynecology Oncology at Oxford Baptist. Thanks for joining us.
Thanks for having me.
Well, first of all, who's at greatest risk for cervical cancer?
So women are the only ones who get cervical cancer. The cervix is the canal that connects the uterus to the vagina. We recommend screening people starting at age 21. It's associated with the HPV virus, and so that's what we screen for.
All right, so it's really simple to know if you have cervical cancer or if you're at risk for it. What's the best test for that? Best
test is the pap smear. Basically what a pap smear is, it's an exam. We scrape the cervix, we look for abnormal cells. This is done with a brush or a spatula. Basically, we're trying to detect abnormal cells that are the beginning of cervix cancer or cells that are infected with HPV.
So at what age should a young lady begin the pap test or to test for cervical cancer?
We recommend starting at age 21, and we don't recommend going past 3 years for screening, and we do that until age 29. The frequency changes after age 29, but essentially 21 is when we would start screening.
21. I guess we see so many cases every year. It's something, you think of breast cancer, you think of that more than you do cervical cancer. Or people sometimes surprised, like, wait, what? You know, when they have this.
The pap test is probably the best screening test that's ever been developed, and that's why the incidence of cervical cancer is so low. So as breast cancer has 200,000 cases a year, cervical cancer is associated with much less, 13,000 cases, and it's because we can catch it before it develops. That's the entire purpose of the pap smear.
Is it like a family history connection, as you would find sometimes in breast cancers, or is it just because of the HPV infection? And you may want to talk more about that.
It's not inherited at all. It truly is exposure related. So the HPV virus is extremely common. Essentially anyone who has sexual intercourse or sexual outer course is exposed to the HPV virus. There's 150 types, only 15 of which cause cervical cancer or are associated with cervix cancer.
I guess the best advice, once a year for a pap smear? Is that good enough?
It used to be once a year, and some people definitely, we do recommend screening them that frequently, especially if there's certain high-risk features associated with it, like HIV infection or chemotherapy or anything that lowers the immune system. But what we've done now is space that to every 3 years in normal risk patients. So you still need a pelvic exam every year, but not necessarily a pap test every year.
All right, Dr. Jacob Estes, thank you so much.
Thank you so much.
Very good information. All right, time now for a check of the forecast with Shelby Latino.